Africa registered its first COVID-19 case in February. To stay safe, people retreated to their homes as government lockdowns and curfews took effect. But for some, home is not necessarily a safe space. Millions of girls and women found themselves trapped with their abusers during these lockdowns, leaving them vulnerable to violence. In this episode of Jambo Studio, we focus on the shadow pandemic, the rising scourge of gender-based violence in the time of COVID-19. Gender-based violence is certainly not new, but as the coronavirus spread across the world, so too did violence against women. This led UN researchers to warn that an additional 15 million cases could be expected globally for every 3 months of lockdown. And from Turkey to the Philippines, the UK and Colombia, police and health service workers reported a rise in cases and emergency calls to national helplines. Here in Africa, the situation was no different. As the burden of economic stresses began to weigh on family members, tension in many households started to rise.
The underlying problems that may have been on ground before escalated, and couples tend to fight more, and domestic violence went on the rise. Thirdly, most of the justice sector, that is the system, were locked down too. So access to the police stations to report issues of gender-based violence, access to the courts were not available.
Stop raping us! Stop molesting us! Stop killing us! Stop killing us!
In just the first 3 weeks of lockdown, South Africa's national helpline received over 120,000 calls. Femicide took center stage as the tragic deaths of Tsegofatso Pule, Nompumelelo Chaka, Altisho Korja, Lindelwa Penny and others made national headlines, prompting President Cyril Ramaphosa to call for an end to these acts of violence.
I am appalled at what is no less than a war that is being waged against the women and the children of our country. At a time when the coronavirus pandemic has left us all feeling vulnerable and uncertain, violence is being unleashed on the women and children of our country with a brutality that defies any form of comprehension.
Despite the president's impassioned plea, the situation on the ground is a stark reminder that more needs to be done.
No means no.
Long before the coronavirus pandemic, South Africa was already one of the most dangerous places in the world to be a woman. Over the years, protests have been held and policies have been drafted, yet little has changed. A woman is killed in the country every 3 hours. COVID-19 related restrictions proved dangerous for women in Nigeria too. According to data released by the International Growth Center, Sub-Saharan Africa's largest economy recorded a 149% increase in gender-based violence. And this was just between March and April, when governments first implemented aggressive lockdowns in Abuja and Lagos. And it's not just physical violence that women were subjected to during these lockdowns. Here in Kenya, authorities noted a significant spike in both physical and sexual offences. Local media reported a disturbing surge in teen pregnancies. Over 4,000 adolescent girls visited hospitals and clinics for prenatal services.
Many girls and young persons were away from school because the schools were locked down too. As a result, they are more exposed to maybe the perpetrators. They have more times on their hands to move around and get involved in dangerous sexual habits and other stuff. So it increased the occurrence of gender-based violence.
For women and girls facing the risk of violence, Being able to escape their abuser is sometimes key to their survival. Makueni County is home to one of Kenya's few government-run facilities that cares for victims of gender-based violence.
What effect does violence against women or against men do to our population? So what can we do to respond to that? And more so during the COVID-19 and the lockdown, because we are locking down and women are going to suffer in their own homes where we feel they are safe. So we thought for them to actually feel secure, we come up with an emergency place where they can call, where they can find their safety.
And this emergency place has saved lives.
We have a team of 6 trained staff in gender-based violence, and this trained staff comprise of a psychologist, a pharmacist, a lab tech, and a medical officer who work together to make this survivor just to cover this survivor at once.
Nilikuwa nachapwa na bwanangu, ananidunga na kisu, ananidunga mashindano, ndio maana nikakuja huku.
The support provided to girls and women who have survived violence extends beyond the safe house. One such survivor is a young girl who was defiled by her father at the age of 12.
At first, I thought that I wasn't dreaming, but the movements kept on coming closer to where I was sleeping. So I just woke up. I lit the lamp. The first person to see was my father.
The rape resulted in a pregnancy that then led to a fistula, a problem she lived with for 4 years before county officials were made aware of her case and stepped in to help.
I would like to tell my fellow children, when they undergo under such situations, let them not give up. But there is always a time for everything. And they should always seek guidance from their trusted people.
The alarming surge in gender-based violence in 2020 forces us to ask an important question. Why is this prevalent at all? The World Health Organization says 1 in 3 women will experience intimate partner violence or non-partner sexual violence in her lifetime. The United Nations Population Fund describes gender-based violence as a universal phenomenon, which includes physical, sexual, and emotional abuse. Female genital mutilation, child marriage, and human trafficking are also considered forms of violence against women. During instability, rape is commonly used as a weapon of war. A 2-decade civil war in the Democratic Republic of Congo, which is driven by displacement over resources, has seen rape being weaponized. Girls as young as 12 years old are abducted and used as sex slaves. Somalia and northern Nigeria have been grappling with Al-Qaeda and ISIL-led insurgencies, which have used a distorted view of religion as a tool to unleash all manner of atrocities on the general public. Cases of women and even schoolgirls being abducted to be used as sex objects are rife.
Gender-based violence is a human rights issue, and I am a human rights defender. I fight for rights for human beings. And it's not actually fair to have 50% of our population actually being violated, being marginalized, being looked down, and yet they are the ones that really carry the family.
With increase of women participation in the political space and in the economic space, more women will be empowered. And if more women are empowered, they can influence policies, they can influence various change in norms in the society. So I believe that with more participation of women in the political space and other public spaces, the rate of gender-based violence occurrence will be on the decrease.
Globally, countries like Iceland, Norway, Finland and Sweden top the list of nations that are closing the gender gap. While here in Africa, Rwanda, Namibia and South Africa are seen as making significant strides in the right direction. In many parts of the continent, women's rights are being recognized as an important part of the national discourse. Women's voices are being amplified through events like Day of the Girl Child and national campaigns against violence. And men are becoming part of the conversation too. A game changer, some might say. As countries emerge from coronavirus lockdowns, the issue of violence against women remains a painful thorn pricking at a continent's soul. Failures to ensure women's safety and survival in Africa, to enact policies that would protect, support and respect women as equal members of the human family erodes at the very core of our humanity. The call for gender equality and justice is more urgent now than ever before.